Today's title reveals something deeply serious. Main health problem? Pancreatic cancer. Main promised solution? Recognizing 8 critical warning signs early enough to act. For adults over 60, this disease is especially dangerous. The risk increases significantly with age, and pancreatic cancer is one of the deadliest cancers because it often shows symptoms late. When detected early, survival chances improve dramatically, but when ignored, it can quietly progress until treatment options become limited. Awareness is not optional, it is life-saving. Pancreatic cancer is currently one of the leading causes of cancer-related deaths worldwide. According to global oncology data, more than 80% of cases are diagnosed at advanced stages. Why? Because the symptoms are subtle and often mistaken for normal aging. Imagine losing your strength, your independence, your ability to enjoy time with your grandchildren, not because help wasn't available, but because warning signs were ignored. Today, we uncover 8 warning signs that could save your life. This information is supported by clinical insights from leading oncologists such as Dr. Sanjay Gupta, who has spent decades reporting on cancer detection and prevention, and research institutions like MD Anderson Cancer Center, which has treated tens of thousands of pancreatic cancer patients. In clinical oncology, early-stage detection can significantly improve survival outcomes, in some cases increasing 5-year survival rates from single digits to above 30 to 40% when caught early. The difference is timing. The pancreas is a small organ located behind your stomach. It produces digestive enzymes and insulin. As we age, cellular repair mechanisms weaken, DNA mutations accumulate, chronic inflammation increases. When abnormal cells begin growing inside the pancreas, they often block bile ducts, interfere with digestion, and disrupt blood sugar regulation long before pain appears. That's why symptoms often seem unrelated at first. Now let's talk about the 8 warning signs. 1. Unexplained weight loss. Sudden weight loss without trying is never normal. Cancer cells consume energy aggressively, causing muscle wasting and weakness. A study published in major oncology journals found that over 70% of pancreatic cancer patients reported significant weight loss before diagnosis. One 68-year-old patient believed his weight loss was healthy dieting. It wasn't. 2. Persistent upper abdominal or back pain. Pain that radiates from the abdomen to the back might indicate tumor pressure on nearby nerves. Unlike arthritis pain, this discomfort often worsens after eating or lying down. 3. Yellowing of skin or eyes or jaundice. When tumors block bile ducts, bilirubin builds up. If your skin or eyes appear yellow or urine becomes dark, seek immediate medical evaluation. 4. New onset diabetes after age 60. Sudden blood sugar problems can be an early metabolic signal. Research shows that adults over 60 diagnosed with new diabetes have a higher short-term risk of pancreatic cancer compared to the general population. 5. Loss of appetite. Persistent lack of hunger is not simply getting older. It may reflect digestive enzyme disruption. 6. Pale or greasy stools. When the pancreas cannot release digestive enzymes, fat digestion fails, causing light-colored floating stools. It may feel embarrassing to discuss, but it is medically significant. 7. Chronic fatigue. Cancer-related fatigue is deeper than normal tiredness. It does not improve with rest. 8. Blood clots without clear cause. Unexplained clotting disorders can sometimes be an early paraneoplastic sign, meaning the body is reacting to hidden cancer. Scientific danger. Delayed diagnosis reduces surgical eligibility. Data. Only about 15 to 20% of patients are eligible for surgery at diagnosis because it's too late. Ignoring symptoms costs time. Scientific danger. Masking symptoms with antacids delays imaging tests. Patient example. A 72-year-old woman treated indigestion for 6 months before seeking imaging. By then, the tumor had spread. Fear delays detection. Early CT or MRIs can identify tumors before spread. Avoiding answers does not prevent reality. You cannot prevent all cancers, but you can dramatically improve early detection odds. A. Act immediately on persistent symptoms. If symptoms last more than 2 to 3 weeks, request imaging tests. Early imaging equals earlier options. 2. Monitor blood sugar after 60. Sudden diabetes should prompt deeper evaluation, especially with weight loss. 3. Reduce chronic inflammation. Scientific benefit. Lower inflammation reduces cancer-promoting environments. Actions: stop smoking, maintain healthy weight, eat anti-inflammatory foods like leafy greens, fatty fish, and nuts. Engage in 30 minutes of moderate daily walking. Research shows lifestyle modification significantly reduces overall cancer risk. 4. Schedule annual health reviews. Ask your physician about risk factors such as family history, chronic pancreatitis, long-term smoking. Knowledge gives power. 5th, mid-video CTA. If you are over 60, your health deserves attention. Please like this video, subscribe to Healthy Care, and comment your age and one health concern you want us to cover next. This channel is dedicated to helping seniors live longer, stronger, and more independent lives. Motivational closing. Pancreatic cancer is aggressive, but awareness is stronger. Recognizing symptoms early could mean more treatment options, fewer hospitalizations, lower medical costs, preserved independence, and more years with family. Your health is not a burden. It is your greatest asset. Do not ignore your body's signals. Subscribe now and take control of your future, because prevention, awareness, and early action can change everything. Stay strong, stay informed, stay healthy.